Thank you everyone for joining us tonight for a very exciting webinar on stem cell therapies. We are very excited to have our Stem Cell Fellowship Director, Dr. Sharon McQuillan, with us tonight to highlight the Stem Cell Fellowship and Module 2 that will be presented on May 19th through the 21st in Hollywood, Florida. Dr. McQuillan is a board-certified physician who specializes in both aesthetic and anti-aging medicine. She received her undergraduate degree and a combined major in biology and chemistry from Kent State University, and then attended the Ohio State University College of Medicine, where she graduated with honors. In 2009, Dr. McQuillan formed the Ageless Regenerative Institute in conjunction with a team of experts in stem cell therapies from the medical, legal, biotechnical, and manufacturing arenas. This expert team has developed an approved method and protocol for harvesting and isolation of adipose-derived stem cells for autologous reimplantation. She is certified in the therapeutic and cosmetic use of Botox, the cosmetic use of facial fillers, sclerotherapy, mesotherapy, chemical peels, the aesthetic use of lasers, tumescent syringe liposculpture, endovenous laser ablation, and ambulatory phlebotomy. Thank you so much, Dr. McQuillan. I will turn the webinar over to you.
Thank you, Lindsay. First of all, I'm very honored to be the director of the Stem Cell Fellowship, which has been my focus for the past 10 years. And it is, in my mind, the most important thing happening in medicine today, and something that will dramatically change medicine for the better. And I would like to share it with all of the people in attendance. The Stem Cell Fellowship is one of a kind. It is truly the only educational pathway that exists today for practicing physicians to develop expertise in cell biology and the methods surrounding stem cells. I'm sure there will be others because a great deal of research is being done, but this is the most comprehensive and best educational pathway that exists today. So, welcome. These are some things I've done. I think Lindsay went through those. Regenerative medicine is really a natural extension of what we as anti-aging physicians do. We have focused our attention on understanding metabolic defects, genetic defects, and restoring health. And no matter how good you are at that with the tools that we've learned to date in the 20 years I've been in anti-aging and however long you've been in it, you reach a point where you really need regenerative therapies. And that is the process of using the human body's own repair and regenerative mechanisms to replace or regenerate diseased or injured tissue. And the results that you can achieve with these therapies it goes beyond anything else that I've seen. Regenerative medicine encompasses not only cellular therapies, which we're going to be talking about today, but growth factors that enhance cell therapy, scaffolds that will help with our delivery and recreating structure in tissues, different delivery systems. Gene therapy is a very exciting area of research, and then just biologics. So again, this is the area of medicine where there is the most active research, and regardless of the specialty that you currently practice, it will have wide application for helping patients. Adult stem cells, which is what we can use today with confidence, are found in many tissues. We'll focus on what we can use within the United States today, and those are bone marrow and adipose-derived stem cells. But in the fellowship, we review all of the different stem cell types, the different stem cells that are used throughout the world in research, and acquaint you and make you expert in all of the different cell types. The primary role of stem cells in your bodies and your patients' bodies are to repair the tissue in which they're found. They're multipotent, which means that they can differentiate into a specific subset of cell types, and they exhibit plasticity, meaning that they respond to the environment in which they are found. So they have an innate intelligence. Mesenchymal stem cells, which are cells of interest, are cells that are found in fat, bone marrow, cord blood, umbilical cord, and elsewhere throughout the body. But the sites of the easiest and most convenient harvest for our purposes are either bone marrow, the mononuclear fraction, and adipose-derived cells. We define mesenchymal stem cells by being plastic adherent. They have a fibroblast-like morphology and culture, and they have specific characteristics that allow us to identify them that are listed here. And as you go through the fellowship, you will understand what these different markers mean and how we utilize and identify cells. These cells are immunomodulatory and regenerative, and they can differentiate into fat, bone, cartilage, and so they're extremely cells. They can also differentiate into blood vessels. Mesenchymal stem cells are periocytes. They exist throughout your body, surrounding the blood vessels and in the connective tissue that wraps around the blood vessels. And they are very useful and regenerative cells. Again, when we inject them into our patients, they immediately modulate the environment, improve the niche environment, and they're anti-apoptotic, angiogenic, mitotic, and they resist a scar cascade. So in regenerative medicine, if you think about the diseases that affect our patients, particularly the degenerative diseases that we as anti-aging physicians seek to either prevent or repair, these properties are very, very useful. Important considerations, because there's a lot of activity in this space right now, and it is being reviewed by the regulatory bodies, and really just to deliver the highest level of care for patients. It's important to have a validated and standardized method of yielding a defined cell product in both bone marrow and adipose-derived stem cells. It's a requirement that these things that the process adheres to good manufacturing consumable products, that all of the equipment utilized is approved for use, all the solutions and reagents are approved for use, and that good laboratory practices are adhered to. And Module 2 actually focuses a great deal on good laboratory practices and creating expertise and understanding in the attendees about what these things are and how to understand them and adhere to them, and that we are operating under approved clinical protocols. The importance of cell product characterization is really simply, as a practicing physician, you don't want to inject something into your patient if you haven't characterized it, if you don't have a complete understanding of what you are treating your patient with. The different cell counts, the properties, have you proven that the cell product that you are injecting is sterile, non-toxic, and has a defined number of cells. Otherwise, there's no way to make sense out of the clinical outcome that you achieve, research that you're participating in, and there's no way to ensure that you have kept your patients safe. So as a very basic requirement, it makes sense to me, and we've designed cell products and methodologies to create cell products that do allow this comfort level, and it's what we're used to. We wouldn't use a device, a medical device, or we wouldn't deliver a pharmacologic agent without a complete understanding, and we shouldn't be doing it with cells either. So it's important to know cell counts. We teach attendees how to understand cell counts, whether it's an automated device, hemocytometry, and staining. We teach our attendees to understand how to define if cells are viable or non-viable, and we also teach our attendees how to characterize the different cells. And it, 10 years ago when I started this, it wasn't an area that I was familiar with, and we're very actually proud of the fact that we've established a faculty that is expert, vitally interested in teaching, and enough experience to help you create this standard as you go forward. Cell yields can be dramatically affected by the surgical technique of the harvest, both bone marrow and adipose, location of the tissue harvested, the reagents that are used in the method to isolate the cells, the separation techniques, and the quality of the reagents. So all of these things have been very well defined, researched, and characterized for you. So the stem cell collection kits were actually made because we have a strong desire for people to do things at the highest level, at the highest standard. And in the absence of keeping everything standardized, it was impossible for doctors to achieve a particular cell yield and to have confidence that these products were safe and definable. So the collection kits that we have currently are for the mononuclear fraction adipose-derived stem cells, MPRP. They are produced according to current good manufacturing practices, and each laboratory kit includes all the consumables necessary, and these are all traceable and, again, in accordance with good manufacturing practices, and they are assembled in an FDA-approved facility. The clinical trial protocols, the question is asked, do we have to, as practicing physicians today, need to participate in IRB studies? And the answer is yes, because right now this is considered clinical research. There are no currently approved uses for adult stem cells in the United States today. And when I first started 10 years ago, this was not as clear, but more and more the regulatory bodies are giving opinions and information that these things can be properly done under clinical trial protocol. And if you think about it, it's a new and emerging field, and this is the proper thing for us to do. So we can share outcome data, we can operate according to protocol so that we can gain a consistent understanding of what we're doing in the field, and we can be responsible to the regulatory bodies, to our patients, and so it's just simply good medical practice in the absence of established long-term protocols for us to rely upon. So what is an IRB? It's a committee formally designed to approve, monitor, and review biomedical research involving human subjects. Its purpose is to protect the rights and the welfare of the human subjects. It is overseen by the FDA. They approve these IRBs. They provide critical, ethical, and regulatory and scientific oversight of research protocol, and it's mandated to adjudicate all adverse events. Serious adverse events must be reported to the FDA. So it's just the responsible and right thing to do. The other thing is, if you're new in the field and you want to introduce these things into your clinical practice, having an IRB protocol, which has been well thought out by all the subspecialties and approved by the subspecialties, is a good practice. It allows for standardization of cellular techniques for specific disease processes. It allows us to gain insight with data sharing and data collection. We have currently instituted clinical trial software, and we have a clinical trial coordinator that allows complete transparency and sharing of data. Established safety and efficacy profile of treatment, and it ensures patient safety. It also helps physicians enter this area and do it in a responsible way that allows them to maintain their credibility. In my opinion, there are lots of behaviors right now in the stem cell arena that are questionable. Current approved U.S. protocols that we have are for the conditions listed, and we have more that we are conducting outside of the United States. But I'm actually very excited because I'm going to meet, again, the FDA in Washington, D.C. to see what we can actually get approved here within the United States. And, so we're actively working with the FDA to try to get clear pathways for this research. We recently got funding for an IND for osteoarthritis, and that will be progressing. The idea here is if we have the cell products approved for one condition, then we can proceed rapidly to others under FDA approval, although the FDA seems at this point to be willing to establish another pathway for autologous cell products. In our current IRB study for osteoarthritis, now this is not the IND, this is just the IRB osteoarthritis protocol. We have over 30 active enrolling clinical sites and 6-month follow-up, and the study endpoints include the standard tools of the short form McGill Pain Questionnaire, visual analog pain scales, and the present pain inventory. And with 324 patients, we had statistically significant changes in improvement in the short form McGill Pain Questionnaire, and with a 76% improvement over baseline. And the present pain inventory improved 61%. And keep in mind, the people that seek stem cell treatments for osteoarthritis are people who have advanced disease and have failed traditional therapy and are trying probably to avoid a joint replacement. So this has been a tremendous addition to our practice, and the patients have done extraordinarily well. With COPD, which is another disease process that unfortunately does not have any good solution in traditional care, we have treated a number of patients, and our primary outcome measurements for safety, secondary pulmonary function tests, exercise capacity, and quality of life. With 112 patients treated to date, we have had an average improvement of 24 points in the St. George questionnaire, and the average increase of 176 meters in the 6-minute walk test. Beyond, the quality of life improvement, the energy, the vitality, and the reduced dependence on medication and oxygen has been very impressive. So why should you add stem cell therapy to your practice? It's an incredibly powerful tool, and patients want and are seeking this type of care. Patients seem to have a very low threshold for believing that stem cells will work in their particular disease process, and that's one of the reasons that I feel very passionate about wanting to make certain that we provide good quality care. And it offers a natural option, and you're utilizing the body's own ability to heal these degenerative processes. Both bone marrow and adipose stem cell therapies are very easy, fast procedures, and I should knock on wood right now, but to date we've not had any complications. It's been shown to reverse and slow disease progression, avoid reliance on pharmaceutical products, and it has a robust safety profile. Another thing to discuss, and I never like to talk about money in general, but we all are faced with Obamacare, and we're faced with trying to keep our practices running. And so you do need to know, if you're thinking about this, that it can be a potentially good revenue stream. I don't think that should be a motivating factor for adding it to your practice, but cell-assisted fat transfers are 5,000 to 10,000, regenerative orthopedics are 7,500 per joint, and so you can afford to add these things to your practice. And I think the really exciting thing and the important thing is that it will allow you to offer outcomes that simply cannot be accomplished through traditional means. So the Stem Cell Fellowship is, in my view, how you can get started, because it is an entirely new field. And 10 years ago when I started this, I really didn't have a good understanding of cell biology. I didn't have a good understanding of cell laboratory practices. I didn't have an understanding of flow cytometry and culture expansion and all of the things that are part of the language that you will need to understand in this field. In the fellowship, you will learn all of those things. You will learn and gain cell expertise, laboratory expertise, so that with confidence and integrity, you can offer these treatments in your practice. You have the opportunity to participate in over 25 IRBs, depending on your area of subspecialty, and you'll understand how to responsibly bank patient cells if that is appropriate, the ability to culture expand cells, which if that is appropriate, and access to allogeneic cell products for patients who autologous cell therapies are not adequate. And then we provide ongoing clinical and scientific support because you will be entering a field that doesn't really have standardized protocols that we're used to in medicine. And so we and my team make it a point to always be available for any questions, and that's a commitment from us. We do provide clinical intensives for the Stem Cell Fellowship so that you will gain an understanding with hands-on therapies, how to treat patients, how to harvest tissue, how to isolate tissue, how to conduct yourself in the cell lab. And we strive to make sure that you feel competent and skilled and that you're doing things properly. We offer advanced programming in the latest in regenerative medicine. There are translational approaches from bench to bedside, procedural protocols, and valid technologies. And it is designed for physicians desiring to add stem cell therapies to their clinical practices. We want to help to standardize this field and promote excellence through best practices, best educational experiences, and the hands-on training, I believe, is critical. We provide the training at our clinic, and then we also come to your clinic to help you get started and to help you set up and to go through the first series of treatments with you. It is the only fellowship certification program provided by a learning institution. It's accredited by the George Washington University and sponsored by the Metabolic Medical Institute. So it's a certification program in regenerative medicine, and the written exam and case study submission are required. Successful completion will result in a listing on the A4M website. It provides a community of peers. We all tend to communicate with one another, which is important in an emerging subspecialty, because again, we don't have 20 years behind us to rely upon. Great forum for an idea exchange and data sharing. Our goal is to create standardization in regenerative treatments and ultimately to have this become a subspecialty. The required modules are 1 through 5. There's basic cell science, which we just did in Las Vegas. The next one, which is going to be offered in Miami, in Fort Lauderdale at the Diplomat on review that with you because I'm hoping that you will attend. Module 3, stem cell harvesting and isolation techniques. Module 4 is a focus on musculoskeletal and neurodegenerative conditions. Module 5 is a focus on cardiovascular, vascular, and respiratory conditions. And for all of these, we have subspecialists that are involved currently in clinical research. The elective modules 6, 7, and 8 are people who are interested in renal, hepatic, GI, autoimmune disorders, and Module 7 is genitourinary, sensory organs, and cancer, and Module 8 is an in-depth study of biomaterials, bioscaffolds, gene therapy, and tissue engineering. The clinical elective modules, which means they're conducted on live patients in our clinic, are regenerative and advanced regenerative orthopedics, the use of PRP in regenerative medicine, and fat transfer that is cell-augmented fat. Module 2, just briefly, are best practices in regenerative medicine. It is a detailed foundation of the best practices that are needed to successfully incorporate cellular therapies into a research and/or a clinical setting. We have an expert faculty, and they will assist you in developing an understanding of the harvesting methods that are available today for bone marrow, adipose, and peripheral blood stem cell procedures, compare stem cell isolation methods for reproducibility, robustness, and cell viability, and really help you understand the different ways to measure these things, how to critically understand them, to discuss the risks, benefits, and applications of the current legalities surrounding stem cell cryopreservation and cell banking. Understand the importance of cell validation studies and cell product standardization and for clinical research and treatments, and become familiar with cell culture and expansion and really understand what's possible, how this is accomplished, and when it's appropriate, and possess a working knowledge of the biomaterials. Pardon me. To discuss the basics of tissue engineering and evaluate current research, and to understand good tissue practices as defined by the FDA, and to learn the importance of good manufacturing practices. And these things are important for your patients, but they're also very, very important for you as practicing physicians, because the FDA has had problems when they investigate different stem cell situations, and it's always that the physicians are not conducting themselves properly in these areas. So we have worked very hard to create a situation where physicians are adhering to the standards that are required for proper practice. To understand the premise of platelet-rich plasma and its uses in regenerative medicine, we use it commonly, and we're happy to share our experience with you. To analyze current state, U.S. and government worldwide agencies on human cells, tissues, cellular and tissue-based products, and to understand how to conduct yourself in participating in clinical research. And again, we have worked very hard to provide an infrastructure that will allow you to do that in a painless way. And it's really exciting and gratifying to be helping to contribute to an emerging field. To review the ethical considerations, and that is a consideration in stem cell expertise and to participate with leading experts in all of these areas. And I have been so grateful and impressed by all of the true expertise, the PhDs, the attorneys, the physicians who are in clinical practice, in their participation and their willingness to share their knowledge and their time to help to develop this program and to help create an environment where you as practicing physicians can, enter this space again in a responsible way. The faculty is Rafael Gonzalez, Vice President of Research and Development of Da Vinci Biosciences. He's responsible for developing many different clinical stem cell applications. He's conducting several FDA trials right now and is truly one of the most gifted and accomplished stem cell biologists that I have met in the past 10 years, and we have the privilege of working very closely with him in the development of this course and in the development of the different cell products and in the research. He's the author of numerous research clinical studies regarding stem cell therapies, and just truly a wonderful asset to the program. Dr. Shalesh Kaushal is the director of the Retinal Specialty Institute, adjunct professor of ophthalmology, and out of Yale and Hopkins. His area of expertise is stem cells and eye disorders, and he has contributed to 30+ publications and has numerous patents involving stem cells and ophthalmology. And Aswa Kasari is a PhD in cell scientist at Da Vinci Biosciences. Her area of expertise is cell signaling, protein-protein interaction, and after working with her, I would say definitely clinical research and teaching. Over 15+ scientific publications covering various types of cells and stem cells, and is primarily interested in the differentiation of cartilage from bone marrow stromal cells. Marcela Salgado MD is a medical research administrator, and she is functioning right now as our clinical coordinator. She worked for 10 years at the University of Miami in their research department. She's the senior clinical research coordinator and research assistant at the University of Miami Miller School of Medicine, and her area of expertise is utilizing bone marrow and adipose stem cells for multiple clinical applications. Published 8 clinical studies involving the use of mesenchymal stem cells in dermatologic procedures. Kevin MacDonald has worked as a consultant in helping clinical research through the FDA. He's got more than 25 years experience and in successfully conducting clinical research, and is the Vice President of Neotrac Concentric Medical, and again is just very, very experienced in clinical research and very knowledgeable. Yvette Jivanjee is in charge of all of the clinical research in stem cell therapy that is being conducted currently at the University of Miami Miller School of Medicine, and is just, again, a tremendous resource. Andrew Ittleman is an attorney who, for the last 7 years, has focused on working with the FDA on the regulatory issues surrounding stem cell therapies and other, and some in nutraceuticals and pharmaceuticals. But his true passion in his area of expertise is stem cells, and he is going to share the regulatory position, as I will, because I've been meeting extensively with the FDA. Father Tad is a PhD in neuroscience and cell biology, and he is the Director of Education at the National Catholic Bioethics Center, a Yale neuroscientist and researcher at Harvard and MIT, and his expertise is in bioethical issues regarding stem cell research. The reviews that we got from the initial stem cell fellowship module in Las Vegas in December are shown here, and these were unsolicited, so we were grateful to have them. But we're fortunate in that I have a great team, and we hear this every day. And physicians are very excited to add these therapies to their clinical practice and to have the support to do it in according to responsible behavior. In closing, addition of regenerative medicine to an anti-aging practice is a natural extension of what we do. I have a bias. I think that anti-aging physicians are better equipped to do these therapies because particularly if you start treating advanced degenerative disease, you will find that you really need our collective experience in metabolic disorders, in hormonal imbalances, in functional medicine, in order to do the best for your patient. Again, these patients are sick, and they're people that have typically failed traditional therapy and are looking outside traditional medicine for alternative therapies. Stem Cell Fellowship ensures successful entry, and it is a very rewarding endeavor. It's been the most exciting thing I have done in medicine, and you will become part of a select Stem Cell Fellowship trained practitioners, and that's, I think, important because this field does need standardized. We are participating in clinical research, and if we don't behave responsibly, the regulatory bodies will put an end to our ability to offer these important therapies to our patients. So behaving in accordance with what I've just shared with you is critical. And the other thing is, it is very interesting and very gratifying to have an understanding of cell biology, to really have a deeper understanding of what exactly you're doing with cell therapy, and to participate with peers in this endeavor. So I think it's the most exciting thing you can do. Perhaps I'm biased, but we would love to have you attend. If you would like to join us in Hollywood, May 19th through the 21st, contact your A4M educational advisor at the number shown or www.a4m.com. And if you need more information or have questions specifically about the program, then please call our Director of Education, Janet Daher, and she's just Janet Daher at agelessinstitute.com. But the A4M is very knowledgeable about this program. They're very supportive of this program, and I believe that their staff, can help handle any questions, but we are also available. So thank you very much for attending. We hope to see you in Hollywood, and then we hope to see you at the clinic. And are there any questions?
Great. Thank you so much, Dr. McQuillan. I'll wait a couple moments for some questions to come in, but I did want to thank you so much for your time, Dr. McQuillan. For those of you that are on the webinar tonight, we would like to extend a very special discounted gift on Module 2 if you are able to join us in Hollywood on May 19th through the 21st. We do have a lot of the attendees who joined in Las Vegas that are very excited to jump into Module 2. And for those of you who haven't started Module 1, we can certainly get you set up with that online and prepare you for Module 2. Dr. McQuillan, I do have one question. What is the current FDA position on adipose-derived stem cell therapy?
Can you still hear me?
Yes, I can.
Okay. Well, that is what we have been meeting meeting with the FDA about. Because the FDA has currently put out 4 different letters, which are not, laws or guidances, but that they intend to regulate adipose-derived stem cell therapies and that they consider them a drug. And so, our response to that was threefold. One is to meet with them to open up dialogue, because I don't think, based on my initial meetings, that they had a good understanding of how many people are doing this, the safety record, or really, a way to regulate it. So they're open to dialogue, and we've had one meeting here in Florida. We're going to have another meeting in Washington, D.C. And they're really open because, in their discussion with me, they said if they knew how to regulate it, they would have done it already, and that they are open to responsible ways that these things can be conducted if presented to them. So that's our next project. So they haven't regulated it yet. They have issued guidances that suggest that they think they should, and that they are planning on doing it in the future. There was a meeting set up in April in order to review the guidelines, and they had a very, very significant response to their guidance that they issued from physicians who are currently practicing with adipose-derived stem cells. And so they canceled that meeting because they realized they had some more homework to do. So we're working with them. I'm aware of other groups that are working with them. And I think, that we're helping to educate them about the benefits and the safety of these therapies. And they're open to looking at creating a pathway for these therapies to be continued. And, there are literally thousands of doctors. We've trained over 500 that are currently offering these therapies to their patients, and they have proven safe and effective. So, I know that's a long answer to just say that, the jury's still out, I guess. But it's not their desire to prevent something that is beneficial to patients, and it's not their desire to attempt to regulate thousands of doctors from providing a therapy that they have found helpful. So I think, myself and others are making an effort to educate them and to help them do something more intelligent than simply say stop. But I don't know. It really is up in the air. So that was the first thing. The second thing that we did is we perfected our bone marrow technique. And the limitation with using bone marrow has always been that traditional harvesting methods and traditional isolation methods did not give you adequate cells to be clinically useful because of those two techniques. So over about 3 years, and with a lot of help from PhDs, we developed an a harvesting technique and isolation technique, which now made our bone marrow method have actually more cells than our adipose-derived stem cells per cc of harvested tissue. So even if, worst case scenario, the FDA asks physicians to stop providing adipose-derived stem cells, then we have perfected the bone marrow technique to a point where we'll have a fantastic alternative. And then, that's how we approached it. And then the third thing that we did is we did file, we're in the process of completing the filing for the IND for the osteoarthritis and just going through the pathway for osteoarthritis, so that if we gain approval for our stem cell product using adipose-derived stem cells, then we'll have that and we'll make it available to everybody. So, you know, we're working on 3 fronts right now to ensure that regenerative medicine can continue legally and in accordance with the FDA.
Yes, fantastic. We want to be mindful of everyone's time this evening. If there are additional questions, please feel free to use your email option. We can address your questions. Again, we want to thank everyone for their time tonight. Again, wanted to mention the $500 discount for the Module 2 coming up in May 19th through the 21st. My direct line is 561-777-6807. And again, we want to thank everyone for their time, especially you, Dr. McQuillan.
Thank you, Lindsay. It's actually my pleasure. I'm more passionate about this than anything right now, so thank you for the opportunity.
Well, we feel your passion, and we hear nothing but rave reviews about the didactics along with the hands-on training. So it's a fantastic movement. We're all a fantastic team. So thank you so much.
You're welcome. Good night.